the public should have been undertaken.
Let's look at Exhibit 378.
This one I've seen before.
And how did you come to see it?
I remember this. I have a copy of this. I remember this like yesterday, with a group of our secretaries in the office stuffing letters and using a machine that was sealing, like they didn't have to lick all the letters. And this was mailed out to everybody somehow that was a patient of Dr. Durrani's to notify him that his practice location was changing. Yes, I agree with that. They had a lot of explaining to do in 2013. They had a lot of explaining to do in 2008. They had a lot of explaining to do in 2007. And they got a lot of explaining to do today.
And what is it that you think that they should be explaining at this point?
They should be explaining why they didn't protect the public.
Do you, based upon your experience with Dr. Durrani from the years that he worked with you at Children's Hospital, have an opinion about his reputation for truthfulness and honesty in the community?
Yes, I do.
And what's that opinion?
I think he was an unethical sociopath.
And you brought this to the attention of Dr. Eric Wall?
I brought that to the attention of everybody in the room. So within the context of what we would call pre-op and post-op teaching conference, x-rays would be put up, discussion would be presented by the resident who had reviewed the patient's chart and would talk about preoperative symptoms, et cetera, what kind of treatments had been used beforehand. And case after case after case is going up of children with this thing called spondylolysis.
All right. So did you raise this with people other than this review with your fellows and your residents?
Absolutely. I brought it up with Eric Wall, my division director, other partners that were in attendance. This was this wasn't couched in secrecy.
And other than Dr. Wall, whose attention did you bring this to?
This was brought to the attention of Steve Muthing, that safety officer. I remember that. I don't know if that email's in here, but I know that I sent it to Steve because I respected Steve a lot, and he was in the new position of being that safety guy.
How did Dr. Wall react to your bringing this to his attention?
I would say not forcefully or definitively. This spondylolysis question that we're discussing was one of the first things that really got my attention, that I said, wow, this is out of bounds. This is different. I conducted research on the topic and published research on the successful non-operative treatment of the problem.
And did you make complaints to anyone other than Dr. Wall?
We had the hierarchy, which was my division director and the people, and so it was Eric's. I saw it as Eric's job to take it up from there. I have my own email record of my discussions, suggesting to him outside reviewers who might be able to look at such cases. I told him Dr. Aziz Khan was our chief of surgery at the time, and I remember using phraseology that said the only thing worse than taking this to Dr. Aziz Khan would be not to take it to Dr. Aziz Khan.
Did you have a conversation other than with Dr. Wall, and I'm talking about with other doctors at Children's Hospital, and we're going to exclude Dr. Wall, the residents, and the fellows?
Sure. So there was the people that we were supposed to educate that you mentioned, residents and fellows. Partners at the time that would attend those meetings beyond Dr. Wall was Alvin Crawford. I believe there was a good period of time there where Dennis Roy may have overlapped still. Junichi Tamai was one of our junior partners that overlapped during some of those years. And another partner that's no longer with us is a female surgeon named Tui Do, who was in a bunch of those meetings during those years.
Did anyone at the pre-op, post-op teaching conference ever tell you to be quiet and stop being so critical of Dr. Durrani?
Yes, they did.
And who was that?
I call this the low point. So this whole thing that we're discussing today, hours and hours around this table with 15 plus people, is what I have described to my colleagues in the country as the low point of my professional career. Is Eric Wall found the way to speak to me and say, Chuck, you've been asked to be quiet. To which I said, Eric, the day that I'm quiet in this conference, you better check a pulse. Because as long as it's my job to teach these residents and these fellows, the next generation of practitioners, how to be ethical and to be evidence-based practitioners, I will continue to speak up.
And at the time that Eric Wall told you to be quiet and stop being critical of Dr. Durrani, he was division director at the Cincinnati Children's?
Yes, he was. And my best estimate, my best guess would be that there was a short list of people who would tell him to say such a thing to me. And those people might have been Peter Clayton. They might have been Richard Aziz Khan. Okay? And it might have been Fred Reichman. But it's hard to imagine who else could give such a directive to my slightly older orthopedic brother.
Based upon your personal knowledge and what we've covered here today, did Westchester UC Health, through their staff and management and their medical executive committee, know Dr. Durrani had issues at Children's Hospital before he applied for privileges there in 2009?
Objection.
So you're asking me if UC Health,
Yeah, if they knew.
the institution that trained him in his residency? UC Health is University of Cincinnati and Peter Stern and the residency, right?
So given that the question, what is your answer?
Is heck yeah, they should. How could they not know? Eric Wall had a funny comment, a striking comment. He said in every category of humans, he said you could take baseball umpires, you could take Mormons, okay, a wonderful group of folks. You could take any, and he said, and there's a certain percentage of sociopaths in every category of humans. You can find them. Maybe in Aboriginals in Australia, you could find who the sociopaths are. And those comments were made in direct reference to Dr. Durrani.
I would again like to reiterate the observation of significant concerns about Dr. Durrani's surgical indications was voiced by many members of the Cincinnati medical community, all of which were relayed to our chairman, Dr. Peter J. Stern. This subsequently was brought up in a formal meeting and discussion with Dr. Durrani in the fall of 2008 during his employment with Children's Hospital Medical Center of Cincinnati. Were you in attendance at that meeting?
No, sir.
Were you familiar with that meeting at the time that it was occurring?
No, sir.
Did Dr. Durrani leave his employment at Children's Hospital Medical Center shortly after the fall of 2008?
To the best of my knowledge, the timing was within several days. Well, I would say what I noticed was an aggressive pattern even during the board collection period. And after he cleared his boards, as we would say, I would say it was much more striking.
And what do you mean by an aggressive pattern to his practice?
I mean stuff that I had never seen before. One of the most horrible cases was one of the very last patients who suffered permanent paralysis at our hospital. The principle was that I saw behavior and support offered to him that was striking. People like Peter Clayton, Sandy Singleton, and other business decision makers built a machine around him. We never had spine nurses like we did until Durrani was there. We never had schedulers that I know of that hung out in the clinic just to schedule the cases as they rolled out. And I sure as heck never saw a surgeon have 2 ORs 3 days a week. A dramatic change in attitude, in my opinion, that was illustrated by our business director, Sandy Singleton, who quite famously became immensely focused on the money that was rolling into our division as a result of Dr. Durrani's activities. She seemed to be quite pleased. And at or about that same time, it became common knowledge in our office, even about prominent gifts that were given to Sandy Singleton by Dr. Durrani, including an infamous mink coat.
Has Children's Hospital ever told you or other doctors and nurses that you're aware of not to talk about Dr. Durrani?
Absolutely. The gag order has gone out no less than 3 times over the years. You don't have to talk to too many nurses who could speak freely who would give you that story.
And what was
It's a joke. It says, "He whose name we shall not say." Well, my personal favorite, and one that I've shared with friends over the years, was after Dr. Durrani's departure. He'd been out for a few months, maybe a quarter. and we must have been having on one of our admin meetings enough that Peter Clayton was there. And I remember it like yesterday. He said, "What's happened to your spine revenue? There's a big drop off." And I said, "Peter, we're now only doing indicated surgery." There were very frequent meetings. He would meet with, I don't know, 3, 4 industry representatives a week sometimes. So when surgeons become the beneficiaries of these companies that are dishing out money, it's been shown very clearly to change surgeon behavior. And I reported him once anonymously to the FBI.
And do you have any personal knowledge of whether or not Dr. Durrani spoke truthfully about patients having already gone through conservative treatment before doing surgery?
Yes, I.
And is there a significance of timely completing procedure and operative reports?
Oh, absolutely. Completing the medical note or the op note or procedure note, whatever you want to call it, has significant clinical ramifications.
Okay, and now let me ask you this, doctor. Are you aware of any occasions where a patient was told by Dr. Durrani that he was going to operate on, let's say, one part of the body, but he would end up operating somewhere else?
Yes, absolutely. So they were educated for the most part on what was going on, whether it was accurate or not. That's a different situation. And then they were also told on what the procedure was. But a lot of the stuff was pretty high level procedures, and so a lot of the times when the patients would come back to me, they would say, they didn't truly understand what the implications of their pathology was, nor did they truly understand what this procedure was, except for the fact that they needed to have the surgery.
Doctor, did Dr. Durrani ever coerce patients into having surgery?
When you tell a person that their head's going to fall off, or they're going to be paralyzed, or they're not going to walk again, or they're going to lose control of their bowel and bladder, and they're going to be pooping and peeing on themselves, I think you're basically telling that person, you need to do this. We would see, we would have our impressions as to what mild or moderate stenosis was. We would see the radiology reports, and then when you see Dr. Durrani's dictated notes, his would be on the other end of the spectrum, calling something maybe what we had claimed as maybe mild or moderate as something that's moderate to severe. And a lot of him being tied to Westchester, he would get a lot of the patients from Westchester. People that simply went to the ER, for an exacerbation of pain or new back pain. They would be sent over to Dr. Durrani for an evaluation.
So would Westchester refer patients to Dr. Durrani?
Yes, they would.
What was the substance of your conversations with Paula and Brian?
Essentially that they wanted to nurture that relationship with Dr. Durrani and CAST. They knew that business was coming over that way, and so they wanted to make sure that Dr. Durrani and his and all his staff were catered to.
Did Paula ever make any statement to you about Dr. Durrani and her relationship?
Yeah. The one statement that always sticks out in my head, and I had mentioned this a while back too, is just, we're partners in crime.
While Dr. Durrani was operating at Westchester Hospital, do you know who the highest moneymaker for the hospital was?
But Dr. Durrani made it very apparent that he was the top producer and was told that he was the top producer. Those were the kind of things that he would come and tell us, and that was something that was supposed to make us as a practice feel happy that, hey, we're a big part of this Westchester operation, and that's why they let us do what we want over there. And this, yes, as a matter of fact, at one point, from what I recall, he had been delinquent almost 6 months, not having done really any type of surgical notes.
And so based on your experience working with multiple surgeons, from conservative to aggressive, where would Dr. Durrani rank?
Aggressive, very aggressive.
What is your opinion of Dr. Durrani?
So I use the term narcissistic, but I would say arrogant, narcissistic. I mean, even to the point where you're being put in jail. You have you've in a sense hurt and destroyed so many different people's lives, and yet you continue to do exactly what you're being put in jail for. We even had patients sometimes that actually went on and said, I was told I needed to go and have surgery right away, and I hadn't even had an MRI. about cast merging with Westchester in some way, shape, or form. Potentially, having a floor. There was, I think, an unoccupied floor. I can't remember if it was the third or fourth floor, but there was some discussion taking place about potentially even having space up there.
In your experience, how frequently did that happen?
Well, it happened a fair amount, because I would hear this from a number of patients. I mean, even to this day, I mean, I follow a few of these patients, and they still remember those phrases, being told to them, about paralysis, and or their head falling off. And
my opinion is he booked too many cases in one day. I was concerned that too many patients were open on the table waiting for him to come into the rooms.
How many would be open while he was waiting?
3 to 4.
And why is it a concern that 3 or 4 are open at one time?
Anesthesia time. And if there's an issue in a case, the other patients are open and unattended.
Okay. So, what is the issue with anesthesia specifically, or are there multiple issues?
Well, the longer you're under anesthesia, there's ramifications for that.
Did he do that regularly?
Yes. He worked long hours, and the staff that were there had to work them too. And I was concerned about their fatigue. I couldn't speak to his level of fatigue, but the staff were very fatigued. The only thing I can recall is Shanti did a full report on a patient, and Durrani was listed as the surgeon, and he didn't go in that room.
And was Dr. Durrani your boss?
Yes.
Did he tell you to perform this surgery?
Yeah, the surgical plan was never my input. He would say, "This is the plan. This is what this is what I'm doing," and so that was it. It wasn't like I'm thinking this versus this. It was already predetermined. This was his plan, and I was just there. So that's where I felt like I was in the room too long, and that was really where it started my discomfort with it. Because at times I would kind of sit there, wait for him to get there to continue on with the procedure. What I thought to be especially certain steps that were integral for him to complete.
No, those issues that you just described.
I mean, they to me, they were pretty bad. He would show up late for cases. He would not be there for the entire case. He would start another case while this case was not fully completed yet. You see any surgeon who's doing that large volume. I think it's easy to say that he was aggressive in his indication. And, when I walk into the OR, at times, we would look through the scans, and I would ask him, what's the reason for surgery? And he would say, he always had a kind of an answer. And I would look at the scans, and I would be like, well, me personally, I probably would not have operated on this person, but not where I have direct access to the patient.
Dr. Shanti, is there any question in your mind that Westchester Hospital knew about all these issues that you've testified about pertaining to Dr. Durrani?
Objection.
Everything was kind of open. I don't think there was any, as far as I know, whatever was happening in Westchester, I would assume Westchester was aware of it.
Objection.
And why would they have been aware of it?
He would want people to know that he's very important. He would want people to know that, he's an important figure to CAS, to the hospital. That's kind of what he projected. That's how he communicated with me, the staff. So nothing was ever kept kind of everything was kind of open right in front of you.
My concerns were regarding the indications for surgery and the appropriateness of surgery. I believe he had a serious complication, as a result of which they had some meetings, and I believe, again, his issue was medical record documentation, but he ended up resigning from Christ.
And when you said that there were serious complications, somebody actually died, is that right?
I believe so.
Objection.
How about Good Samaritan Hospital? Were there any investigations that you're aware of that took place there?
Yes.
And what took place there? And how did you become concerned about Dr. Durrani's practice methods?
You're asking how I first became concerned?
Yeah, how did you first become concerned?
I imagine it was seeing patients who were coming to see me for a second opinion, and I felt that I had a different opinion about the care of those patients.
And did you believe that UC Health and Children's Hospital Medical Center, at that time that this email came into your inbox, that they had things they needed to explain about Dr. Durrani?
I believe that they would have been subject to questions, which is what we predicted. Questions would be asked.
You had been asking those questions, correct?
What questions?
The questions about Dr. Durrani's practice habits.
We had concerns.
Do you know if Christ did any investigation?
Again, hearsay, but yes, I believe so.
What do you know that Christ did?
I believe he had a serious complication, as a result of which they had some meetings, and I believe, again, his issue was medical record documentation, but he ended up resigning from Christ.
You said that there were serious complications. Somebody actually died, is that right?
I believe so.
How about Good Samaritan Hospital? Were there any investigations that you're aware of that took place there?
Yes.
And what took place there?
I believe he had another serious complication, as a result of which an investigation was performed.
Did you ever perform any surgeries with Dr. Durrani?
Yes, I did. I had a handful of cases that I disagreed with the management. In all honesty, there was no cocktail hour where there was more than 2 orthopedic surgeons in the room that Dr. Durrani was not going to be part of the conversation. So Dr. Colosimo and maybe everyone else in town could have been.
Based upon your knowledge and experience in the various patients you saw, did you have an opinion about Dr. Durrani's reputation in the Cincinnati area medical community as a spine surgeon?
His reputation was one of being an aggressive surgeon. I agree, it's a sad day for our profession where an orthopedic surgeon is being accused of these issues.
And did you believe that the accusations had merit?
Yes. So multiple people have said multiple things. He had research irregularities, a personal relationship with staff member. He supposed someone had reported him to the board, and the board had said that they were going to investigate him, and then he said that if you investigate me, I'm going to resign. He said, we have to investigate you, and so he resigned. As I said earlier, there really wouldn't be a single spine surgeon in town who didn't know about this, and we had conversations with a dozen spine surgeons in town.
I understand. So prior to his indictment and him leaving the country, prior to that time?
Prior to his indictment, there wasn't any conversation at MEC about him. It wasn't until his indictment that it became subject of conversation.
And you said it was common knowledge that he had issues dictating his operative reports and discharge summaries, correct?
Yes. Yeah. I saw a patient who had surgery, and the operative note was dictated 9 months after the surgery.
Did the operative note seem to be consistent with the surgery that was performed?
No.
Well, you were frustrated with what was going on, correct? And you expressed that frustration to people throughout the medical community, the spine community, correct?
Yes.
And in so doing, there was a lot of talk in the entire community about it.
Absolutely. He submitted an abstract, but then it had to get retracted. And I was actually at the meeting in Toronto when it was still on the agenda. And they're standing there saying, "Where's Dr. Durrani?" And then they said, "Okay, I guess he's not here," and they moved on. But it was still submitted, and he never presented the actual research, though. He submitted an abstract. So you submit an abstract saying, "I have 99 patients who have done this technique or this surgery on and treated in this way, and 99 out of 99 did very well," and which is the kind of stuff that then looks like, well, that can't be right. Because he had retracted it at that point, but it was too late to change the agenda.
What were the surgeries, if you recall, that you scrubbed in on with Dr. Durrani at the Christ Hospital?
Early 2005-06.
And when you scrubbed in on those surgeries with Dr. Durrani, I assume you looked at records to see what the surgery was about and why the surgery was being done.
No.
Did you actually perform parts of the surgery?
Yes.
And do you know if there were any complications from any of those surgeries in which you participated?
No.
Did you see anything while you were doing those operations to indicate the surgeries were not indicated?
I disagreed with one case where an anterior procedure was going to be followed by a posterior procedure.
Did you raise that issue with Dr. Durrani?
Yes.
And did Dr. Durrani explain to you why he was going to do the interior followed by the posterior?
Yes.
And was that satisfactory to you, his explanation?
No.
So why did you continue with the operation?
I did not.
You backed out?
Yes.
I remember in one conversation that I directly had with him that he was concerned and frustrated. My understanding was that an external review was done on his cases at Children's Hospital.
Prior to 2009, did you express your concerns to any of the spine doctors or administrative personnel at Children's?
I remember the discussions I had were primarily with Dr. Melman and with Dr. Wall on it. I felt that some of the patients that I was seeing whom he had treated were not treated according to standard of care. I felt that the treatment was aggressive.
I would again like to reiterate that the observation of significant concerns about Dr. Durrani's surgical indications was voiced by many members of the Cincinnati medical community, all of which were relayed to our chairman, Dr. Peter J. Stern. Do you agree with that sentence?
The word many is, I don't know how many members of the Cincinnati community. I know that we did. I don't remember whether I expressed it or it was a mutual basically that the surgical treatment of pars fractures appeared to be very aggressive by Dr. Durrani.
And what do you mean by aggressive?
It was not according to standard of care.
Which were the surgeries that concerned you?
I believe many of them involved pars repairs. This is specifically at Children's Hospital. Within the spine community, he did not have a good reputation. In the spine community, it was felt that he was a very aggressive surgeon with his surgical indications.
Right.
I felt that his imaging studies did not, and his clinical presentation did not support surgical intervention. It was the same concerns we've discussed about his surgical indications, in some cases not meeting standard of care.
Okay. What about paralysis? What familiarity did you have with complications of paralysis with Dr. Durrani's patients?
There was, I believe, one patient that I knew about.
Are you aware that ultimately there were over 500 lawsuits filed against Dr. Durrani?
I heard that.
Objection.
I did one surgery with him at Christ Hospital. It was probably my first week in practice. He asked me to, because I had just started and I had really no patients to see, and
Okay.
it was my first week, I think, literally, and he asked me to come and help him on a case.
Okay, and do you remember whether, in your professional opinion, it was appropriate to operate on that patient?
I remember not agreeing with the surgery. And
With that surgery?
With that particular surgery.
And yet you
yes.
did the surgery with him?
No, I actually left about an hour into it.
Why is that?
I just didn't agree with what was being done. However, I was, so when I came back in 2008 is when things had changed. We felt they should be investigated.
And what was that conversation with Dr. Wall, if you recall?
I don't recall it in great detail, but I expressed the concerns that Dr. Guaniciale had relayed or written to me, and I told him that I wanted to look, this must be looked into. He was a little reluctant at first, and I told him that if he didn't look into it, I would contact legal counsel at Children's Hospital and ask them to look into it. Based on that letter, I felt that I needed to, in my capacity as chair, I needed to discuss his concerns with the individuals at the Children's Hospital Medical Center. I only know that Dr. Durrani resigned very shortly after that meeting.
When did he resign?
I can't tell you the specific date, but it was, I would almost swear that it was within 10 to 14 days of that meeting. It was quite precipitous.
I mean, making these kind of allegations against a peer in the community is pretty serious, isn't it?
Yes.
Did you inform Dr. Crawford?
I informed Dr. Eric Wall at a point.
Okay.
Yeah.
Let's start with Crawford. Did you ever tell Dr. Crawford you were doing this?
I recall at the time that Dr. Eric Wall was seemed to be the person who was in charge of all of Orthopedics Children's, and so we want Dr. Eric Wall know. Yes.
So Dr. Wall was informed that you and your residents in Agabagi and Ascot were reviewing imaging studies from children's on Dr. Durrani's patients.
No. Dr. Wall was informed that the residents were presenting concerns about surgeries being performed by Dr. Durrani. I had more conversation with Dr. Wall about the research.
Okay.
You testified that you spoke with Dr. Wall regarding the research issue, correct?
I did.
Okay. And
I called him from Toronto.
Okay. And did he confirm your concerns?
He did.
Do you know why Dr. Durrani was able to continue to perform surgeries after his resignation at Children's Hospital Medical Center?
No.
Were you aware that he was continuing to do surgeries? Did you have an issue or a problem with that?
That was a serious inappropriate sexual relationship. We addressed it through HR, and the issue never got resolved. We set up an action plan. Dr. Durrani did not comply with that action plan. Dr. Durrani's HR problems were becoming an issue with his employment at this point because he was violating hospital policy.
Isn't it true that there were serious concerns being raised by Dr. Guaniciale about Dr. Durrani that led to this meeting with Dr. Stern and Dr. Aziza Khan, correct?
Objection. You can answer.
Yes. Because of all those issues I was talking to you about, the HR issues, the research issues, is he was becoming, as division director, he was taking up an inordinate amount of my time. And so I would say I would have liked him to get, I didn't want him in my division anymore.
You wanted him to move on.
Yes.
Right?
Well, I didn't want to be taking care of him.
All right, and that wasn't just wasn't just the HR issues, but it was all of the surgical issues that were coming up as well, correct?
Objection. No, I'd say it was all the issues.